philosophy and psychiatry module, there'll be a range of questions around the ethical issues that arise in the practice of psychiatry. Probably one of the most fundamental ones is, what is a mental disorder? Some people have tried to characterize that in biological terms, what is correct biological functioning, or in terms of evolutionary fitness, but that doesn't seem to work in some cases. Some mental disorders, or what we want to call mental disorders, seem to be normal responses to abnormal situations. So post-traumatic stress disorder, phobias, anxiety, these could be normal, maybe even fitness enhancing, but they tend to impede with our view of a good life. So if our values around what counts as a good life are part of how we define mental disorder, that raises other problems. Might we be creating diseases for unusual sets of values that we don't like, where we shouldn't? I mean, for many years, homosexuality was considered a disorder. We may be overdiagnosing ADHD. Perhaps addiction we've called that a disease, but is that really just people who like using recreational drugs? Is it our moral judgment that means that we call that a disorder? So there are a range of issues to work through there to try and decide what a mental disorder is, and to make sure we're not just deliberately marginalizing minority groups with psychiatry as a tool of exploitation. So that's one set of issues. Another set of issues arises around moral responsibility. When is someone morally responsible for immoral actions they may do while their disorder is in effect? So is the addicted person responsible for stealing money to feed their habit? And if so, how much? Should they be punished? And to work those kind of things out, we need to look at the neuroscience, we need to look at the social science to get a handle on that. Is this fully controlled action or not? This also feeds into treatment. What is going to be appropriate treatment for people with addiction? If they're completely out of control, then that may justify treating them against their will. But if some control remains, then perhaps treating against their will will be ineffective. You're going to have some buy-in from the person who's suffering from the disorder if the treatment's going to be effective. So it's important to be able to answer these questions to know how to proceed in terms of doing psychiatry as best as possible.